So welcome to our Arthritis Advocacy and the 2022 election webinar, our year in review. As I've mentioned a couple of times, this is a Teams webinar, so you all are on mute and off video for this call. So you are welcome to interact with us, ask questions, and put your comments in the chat feature or the Q&A feature here on Teams. And we will be answering questions throughout the entire presentation. This is who you will be hearing from today, is myself and some of my colleagues that you can probably see on the screen here: Anna Hyde, Alisa Vidulich, Melissa Horn, and myself. And you might see a new face there on the screen. Melissa Horn just joined us last week, was our Thanksgiving present here on the advocacy team. So I want to give her the floor to introduce herself and share a little bit about her background and what she's looking forward to with us here on the team. So Melissa?
Absolutely. Hello, everyone, and pleasure to be on board with the team for the Arthritis Foundation. As was mentioned, I started last week. Today is day 7 as your Director of State Legislative Affairs. I have come from a background of advocacy across several nonprofit associations, including the American Cancer Society and Heart Association in terms of health advocacy, but most recently was with the National Association of Realtors, covering policy across all 50 states. So a variety of legislative policy areas that I've covered, but my personal passion as a 3-time cancer survivor is working on chronic disease issues. I had lymphoma in high school, breast in 2017, and am a current thyroid cancer patient. So, assessing access to treatment and care and the full life cycle of management for those living with diseases is something that is a personal passion of mine, something I really look forward to working on as we get into our legislative priorities for 2023. The state legislative environment will be very active in 2023. So we have a lot of engagement, I'm sure, that we'll be coming to you all with as we jump into the advocacy arena for the year ahead. So thank you all for having me on your team, and however I can be of help, feel free to reach out, and I'll touch base with all of you soon.
Wonderful. Well, welcome again, and you have some warm welcomes in the chat as well. So looking ahead to our call today is a pretty basic flow here. We're going to do our traditional look back, look ahead. So we will, just as it sounds, look back at 2022, the progress that we made, topics that we tackled together as staff and advocates, and then we'll look ahead to see what those look like in 2023, what new things are on the horizon for the new year. And then, as we teased in our elections analysis last month, we're going to dive into that a little bit more now that we have a little bit more information that's come out, and talk about its implications for our priorities and just all around what the year is going to look like. So like I've said, feel free to put your questions in the chat or the Q&A box, and we'll be taking a look at that throughout the call, and we'll have some time at the end to cover anything that we might have missed along the way. So let's dive right in with the big topic, the favorite topic that I'm sure many of you are familiar with, have heard a lot about from us, step therapy reform. And so just for a refresher, if there's anyone a little bit newer to the program on the call, step therapy is also called Fail First. And it's a practice used by insurers that requires patients to try a drug or different kinds of drugs that are preferred by the insurance company. So think you get prescribed a biologic or something like that, or a higher cost drug. You know that it works for you, and you go to the pharmacy and are not able to get that medicine because you need to try a lower tier drug first. Even though you might prefer, you and your doctor might prefer to take the originally prescribed medication, you might be forced into taking a different one at that moment. So Alisa can talk a little bit more about where we've been on the federal and state levels, and exactly what kind of exceptions, processes, and guardrails we're talking about as far as reforming the practice of step therapy. She's been the expert and co-chair of the Safe Step Act Coalition, so I think I'll let the expert take it from here.
Well, thank you. Like Stephanie said, I'm currently serving as the co-chair for a big coalition that we sit on. There are over 207 endorsing organizations, which is win for the year. It is the largest number of endorsing organizations ever. So that is really big success news for us as a coalition, and great that we get to have our name up front and be leading that direction and strategy there too. Another big win for the year is that we have, shout out to all of you all because you helped us to get here. We have the largest number of co-sponsors ever of any Congress that this bill has been introduced. There are over 191 officially on the website for the Congress. I will say we have several who have also signed on, but have not been updated on the website. So I think we're probably up to 195 at this point. And I think that is a really, really big win. So kudos to all of you for your diligence and reaching out to your congresspersons. We also have the largest number on the Senate side. We added 17 co-sponsors this year who previously had not been co-sponsors on the bill. That's a really big deal in the Senate. So keep it up. We really appreciate all of your hard work this year. I know many of you had reached out in the spring and then had August recess conversations with them too. We also have done a really good job at the staff level of meeting with committee staff, of meeting with different Hill members and their staff as well, and trying to promote our numbers and kind of move the bill. We want to make some movement. And so building on the momentum for this year, I think we are going to see a lot of movement next year. That is our hope. We are teeing up like a really big rally cry for the beginning of next year to try to add all of these co-sponsors on again, reintroduce the bill early on in both the House and the Senate. And I will keep you posted. So stay tuned on that. But we are very excited to see some positive momentum this year and have gotten reassurances, depending on how things shake out. We'll talk more about that later, but I'm looking forward to seeing that. We're on the state level, step therapy reform passed in 4 states, which is amazing for this year. It's an election year. Sometimes not everything gets to be front and center, but it happened in Kentucky, Tennessee, Massachusetts, and Pennsylvania, with both Massachusetts and Pennsylvania just this month. Sorry, it's December 1st now. Last month, November 1st and 3rd, the governor signed those bills. So that's great news. We've been working very hard. I know many of you had shown up in person or virtually to connect. So those are big wins. And we have 36 states now that have passed reforms. We'll continue working with the same coalition and on our own. Melissa will be championing some work for us at the state level and in states that have already passed laws looking to strengthen some of those bills. So great wins on step therapy. Let's go to the next slide. We have a lot of other subject areas we'd love to talk about. I'm going to bring in our wonderful fearless leader, Anna Hyde, to join us here. As you know, there are several topics we talk about. So Anna, I'll let you share some about those other subjects.
Sure. Happy to be here. So many of you know, you've been following through this entire Congress that we're about to wrap up here, that our main issue that we wanted to bring to this Congress was out-of-pocket issues and really just the pocketbook. That was sort of the major talking point that was going around, you know, the major committees of jurisdiction, really wanting to do something on out-of-pocket costs and drug pricing and those sorts of things. So we spent a lot of time this Congress working on those issues, and we were really hyper-focused on the Medicare Part D out-of-pocket caps. That was a major priority of ours based on years of patient stories, the really in many cases, very sad stories of patients who got onto Medicare and couldn't afford the out-of-pocket cost because there are no caps in Medicare Part D and had to transition to another drug. In some cases, those drugs don't work as well. And so we decided to make that our #1 priority. And we are really grateful to have success on that. It was a major group effort along with other patient groups and provider groups and other interested parties to get that over the finish line. So I would say that was our major congressional win this year. Granted, the caps don't go into effect for a couple couple more years, but one of the opportunities we'll have in 2023 and beyond is to hopefully help shape what that implementation looks like, because as you know, passing the legislation is just the beginning. Then there's the whole process of actually writing the regulations. What is that going to look like? And so there's a lot of details to sort out, and we are hard at work already trying to make sure the patient voice is really front and center as the administration sorts out the very many questions that are going to be required to get this up and running. So with that, the other key topics, accumulator adjustment programs is another one that we consider definitely a pocketbook issue, because it means that if you use copay assistance to help pay for your medications, and you are in an accumulator program, what's happening is those copay assistance dollars are not counting towards your out-of-pocket liability. And as a result, when you run out of your copay assistance, you are now on the hook for your entire out-of-pocket liability. And many people aren't really aware they're in those programs. And so what we have been trying to do is really limit the utilization of those programs. We've had a lot of success at the state level over the last few years, and we'll continue to have a lot of target states in 2023 and beyond. We're going to keep up the momentum there. Federally, we do have legislation as well, the Help Copays Act. Hopefully you all have taken action on that as we've sent out action alerts. We are already looking forward to who our bill champions will be next year and really taking the lessons learned and, you know, making it even more of a win. So that's a baby issue in federal legislative terms. I would say, you know, the step therapy is probably in adolescence now. Maybe it's been around for three I think Congresses now. Accumulator adjustment programs are very new congressionally, and so we're still in the baby years. And those of you who have worked with us for a long time know that it takes a really long time to really get things done. The pediatric workforce shortage issue that's also listed here is a good example of that. That's something that was passed in 2010 as part of the Affordable Care Act, getting loan repayment for pediatric subspecialists. And it took all the way until this year, 2022, to get it actually funded for the first time. So sometimes we're playing the long game. A lot of times we're playing the long game. And so I just say that for anyone who gets discouraged along the way that, oh my gosh, we have to go back and talk about step therapy yet again. Yes, but stay with us because it will have payoff in the end. And each year, like Alisa said, we do have more and more support there. And I see Susie put in the chat that we had a very sad development this week where our lead Democratic supporter of the Help Copays Act did pass away suddenly. So we're very sorry about that. He was really a wonderful champion of that issue. And we're going to be looking at potential new Democratic champions for that bill going into next year. And then biosimilars is the other area I'd want to call attention to. This isn't necessarily federal or state. It just sort of encompasses everything. But this is something I hope that if you haven't really heard this term or really interacted with what we've been doing on this, that you will, because what we're sort of gearing up for in the next month, in fact, is the patent of Humira is going to expire. And that means that the biosimilar medications for Humira will be allowed to come to market. So a biosimilar it's not an exact generic because it's not a small molecule. These are biologic medications are living organisms, and so there's no such thing as an exact copy. So we call them biosimilar instead. These have been approved for quite some time, but until that patent expiration happens, they've not been able to come to market, and that is about to change. And it's the first time on the self-administered side, if you take a self-administered biologic, that these medications will be available to you. And so we want to make sure that patients are educated about what the change might mean for them. We're working with stakeholders across the ecosystem, providers, manufacturers, payers, PBMs, pharmacists, you name it. We are out front talking to them about why it's important to be really proactive about their communication and education to patients. We just launched last week a landing page on our website. The link is here on this slide, where it'll be a one-stop shop for everything we're doing on this topic. So it includes our position statement we published in August, a webinar that we did earlier this month, actually now last month, a podcast that just went live, I believe last week or the week before on biosimilars. And we're going to continue to add on information. We're working on a set of practical FAQs about, what switch to a biosimilar might mean to you, everything from will copay assistance be available to is the injection device going to be different, all those kind of practical questions that we know patients have. So stay tuned there. That'll continue to be a major hot topic that we're going to follow in 2023. Let's move on to the next slide.
Sure, and I want to get at a couple of questions that came into the chat, if I can put both of you on the spot, is Is there a simple way? This is a trick question. Is there a simple way, or is there a way that patients can learn whether they are on a plan that has an accumulator adjustment program? How will they find out?
That's a great question. So there's a couple things I would do. I would go into your plan materials. I feel like it is a little easier to find these things now that everything is really electronic. Go into your plan materials and do some keyword searches. It's not always going to be on page 1, 2, or even 5. We've done a lot of looks at publicly available plans, like in the health exchanges, state exchanges, federal exchange plans. And sometimes they're buried, tens of pages in. But I would do just some keyword searches looking for accumulator adjustment, anything with copay assistance, and any term that includes that. I would just take a look and see what the language says. And it would be something like, your copay assistance does not count towards your out-of-pocket costs or something like that. If you do that and it doesn't show up or it's not clear, I would just pick up the phone and call and say, hey, I know about this program. I want to know if my particular health plan is utilizing this. I want to know exactly what my copay assistance is covering and what my out-of-pocket liability is, and make sure that you get the answers that you're looking for. So those are the two things I would do.
Perfect. And then I know there's another question here as well from Judy about, is there a way for us to advocate on these issues patient to patient? And I think specific to accumulator adjustment programs, I think a lot of it, like you're kind of insinuating here, is awareness. So as much as you can share that these are things that other patients of any kind of disease type, bigger than just arthritis, can experience. Pediatric workforce is bigger than just pediatric rheumatology. Accumulator adjustment programs affect all different kinds of plan types. And, there are biosimilars that could be available for different disease types as well. So I think awareness is one of the biggest things. And then if you can loop them in to head to our website, this biosimilars landing page is a great spot. Just get them the information that they need to kind of conquer that, overcome that barrier that they're facing at that moment, and then see if they want to join the team to help make sure that those things happen a little bit less in the future. I'm not sure if Anna or Alisa has another thought on that as well before we move on.
I would just say we always love when people help spread the word. So if you are part of a state advocacy committee, a Connect group, a local leadership board, even, Facebook groups and Twitter or whatever it is, when we send out action alerts on these issues as they come up, to be able to forward them throughout your networks, I think is a really helpful way to just bring awareness to the issue. And we always look for that because our reach is only so big. It's the people who are in our advocate pool. And there are many others that we want to reach and potentially have a good impact with. So we always welcome that.
Wonderful. And I know there were a couple of other topics that we also worked on a little bit throughout the year that we had on mind to talk about. I think Alisa is teed up to talk through some of those kind of hot topic news issues that came up throughout the year and different things that happened. If you wanted to touch on a few of those here.
Sure. I'll tag Anna in too if you have additional comments you want to share. But so those are the big four that I think we've really been focusing a lot of our energy on, especially at a staff level, but most importantly from an advocacy perspective. But we want you to know that we're also being really proactive in other areas. Anna touched on biosimilars, and biomarkers is a big subject that we're working on too. It tends to be a little wonky sometimes. We've also been responsive in things that have happened over the year. The methotrexate issue over the summer, we were, shared a whole survey. We created a new feedback loop with our stakeholders to be able to develop really rapid response connection points with them to figure out what's the issue, where are things happening, what's our ability to respond quickly and in live time or as close to live time as possible so that we can help you, the patient, as quickly as possible. There are things also that we touched on that are not legislative, but more regulatory, like Anna was mentioning. Once the bills are passed, then we have to follow through and help to implement them. And one of those is the No Surprises Act. We were really involved in that, 2020, I think that bill passed. Is that right, Anna? And so now we're in the implementation phase. There are things such as getting access to your doctor's notes, that you're able to see what they're writing in your medical chart. That was a big one for this year too. And also I want to let you know that we have been really active on the telehealth subject, working on extensions for the year. Have been really important to our patients, and we're hearing you loud and clear. So we've been working diligently to ensure those telehealth opportunities for you to connect with your doctor either out of state or to not have to go into the doctor's office and take a half day or a full day off of work every time you just want to ask a couple of quick questions, and a variety of other issues. So those are just some of the other topics that I think are important that you know that we are working on your behalf to advocate for. Are there other subjects there, Anna, or anything else you wanted to touch on for other policy subjects or questions?
I think that covers a lot of territory. I think we are ready to move into the really fun election talk with Stephanie's sort of segue coming up here.
Yeah, so I think just to wrap this all up, like why does it matter to you all as ambassadors, as advocates? You can see that there are dozens of topics that we are working on throughout the year, all of us together. And so we are bringing some of these new issues, some of these existing, more familiar issues along with us into 2023. But really now more than ever, as we're dipping our toes back into in-person meetings and lobby days and things like that, but also still existing in the virtual advocacy world, it's it's important now more than ever for you all to personalize your messages, to build those personal connections and relationships with your legislators, with your legislative staff, with your immediate community, the arthritis community and beyond that's around you. It's, you know, it looks like personalizing your message when you send an email through the Action Center. It is engaging on social media if you are on Twitter or Facebook or wherever, virtual or in-person town halls, whatever it might be, those personal connections, sharing your story, and really putting a face on arthritis and these complicated policy topics is really going to make all the difference. So with that sappy note, we'll move straight over into our elections analysis that I think everyone has been really excited to hear about. So I'm going to pass it to Alisa because this is totally her wheelhouse, her nerd space, and I'm excited to dive in.
It's definitely my nerddom. I get very excited after working in the state of Ohio and state elections for my very first job after college to now. I think it's really an exciting opportunity to look toward how big of an impact these elections have had and talking about how they're going to affect our priorities. Let's go to the next slide. So this year, you all know, you've heard a lot, depending on where you're living too, but remember there are 435 voting members in the House. There are 470 seats total in the US Congress, and all of those House seats were up for election on November 8th. The seats of 5 of the 6 non-voting members, such as yours truly in DC, those seats were also up for election as well. So you will see there are a number of freshmen or first newly elected members in the upcoming Congress, 58 new members in the House, 6 new senators, 1 Senate race yet to be decided, that being in Georgia. So we will TBD and see how that election plays out, or the runoff election. In the Senate, 35 of those seats were up for election. That is a large number as well in the Senate. And as we all know, there's currently a Democrat majority still. There are 48 Democrats that have won and 2 independents that caucus with the Democrats. So we kind of tie them all in together. There was a net seat gain of 1 for the Democrats. And like I just said, in the House, all of the House seats are up for election every other year. We do expect, let me see if we talked about this in the next slide or not. We do expect that there will be some turnover in leadership too. Let's go to the next slide. There we go. There are some interesting leadership changes, and I think that this is going to shake up some of how bills move, how things progress, what the priorities are. As you know, the House majority party will become the Republican Party. Kevin McCarthy won the party nomination for House Speaker. So each party nominates who they want to lead their party. And then in January, when they're all sworn in officially, the entire chamber officially votes on the speaker. So while Kevin McCarthy has won the GOP nomination, he will technically have to garner 218 votes from the entire chamber to become the Speaker of the House. This week, actually just yesterday, the Democrat caucus nominated their leader, Hakeem Jeffries from New York, won that election. He will become the first Black member to be in leadership in either chamber, which is really big news. And we will see some potential other leadership changes in the next positions too. There were some assumptions of who else might be joining him. We can talk about more of that later at the end if you're interested. Several hot names were floating around there. I think this is my personal opinion, I think the most pressure is going to be on Chuck Schumer to win the Senate Democrat leadership role again. You know, since Hakeem Jeffries will be relatively young as far as our American Congress likes to go, we tend to skew a little bit older for our leadership members. And since Hakeem Jeffries will be a younger member in a leadership role, I think a lot of the quote unquote adult in the room is going to fall onto Schumer's shoulders. He's going to have to take the reins as the leadership in the Senate. And particularly with Joe Biden as president, now that Nancy Pelosi is, taking a step back and being replaced by a less experienced successor, I think Chuck Schumer is going to have to step up. So I'd be curious to see what happens in the Senate with leadership there. There are several Republicans that are running for GOP whip, for example. That one's going to be interesting. So keep in mind, there are some official debates yet to happen, but everybody will be sworn in per the Constitution on January 3rd at noon. And that is the official safeguard of transition of power there. Let's go to the next slide, Stephanie. There are some interesting developments too with committees. I'm going to bring in Anna here to talk a little bit about what that means. But these are the committees of jurisdiction that we really focus on because they have an impact on healthcare bills and legislation. So I'd love to hear, Anna, what your thoughts are. Why are we talking about committees that don't necessarily look like they're healthcare related, and what is the importance of leadership maybe in leading prior authorization passage or step therapy, some of those inside thoughts that you have there?
Yeah, so the Senate Health Committee handles all kind of public health related issues. So a lot of the issues that we care about, so like step therapy, for example, would be referred to this committee. Senate Finance Committee does financing, including Medicare. So like the out-of-pocket work that we were doing this year on Medicare Part D was all Senate Finance. So it depends on the issue. My guess is that in the next Congress, we'll be spending a lot of time with the HELP committee, because I think a lot of the issues that we're going to focus on are in that more kind of access, utilization management, trying to make some traction on the just health coverage access pieces that are going to be more in the health jurisdiction. This one is kind of a wild card right now because, these still have, the Senate committee still have to kind of have their own reshuffling as the new Congress comes in. So we don't know how the committees will be fully set yet. But the sort of going wisdom is that on the Republican side, that it'll be Senator Bill Cassidy from Louisiana, who is a healthcare provider by training. He's been in Congress for a long time. And incidentally, on the Part D out-of-pocket issue, he was our top Republican champion. He and Senator Menendez had done the standalone legislation that got rolled up into that bigger package. So he's already intimately familiar with a lot of our issues. On the Democratic side, the kind of wild card there is, will it be Bernie Sanders, who of course tends to be a more on the kind of progressive side, less on the moderate side, and how will that influence, if he ends up being the chair, how will that influence the type of work and bills that committee takes on? So that is one of those really remain to be seen items in my mind. In the House Ways and Means Committee, I should step back for a second too. And some of the existing folks like Senate Finance Committee Chair Ron Wyden, continues to express interest in kind of getting at out-of-pocket issues and things like that, but also around, what we can do around telehealth expansion. There seems to be a lot of bipartisan support there, which is great. Some of the issues that we care a lot about, telehealth, making sure that those protections that were put in place during COVID are able to stay around. And mental health, there was actually a big mental health package or sort of legislative hearing that was done this week, because there's so much emphasis there, particularly on mental health for children. And so those are some issues that we'll also be able to, I think, work with that committee on in the next Congress. So going over to the House side, the House Ways and Means Committee does the majority of healthcare financing and Medicare, but Energy and Commerce also looks at some financing things. So that's a little bit different than the Senate, even though it is mostly Ways and Means. The Energy and Commerce Committee is the public health programs. So interestingly, not the step therapy bill at the moment, but that's maybe subject to change. This gets really wonky, but the House Education and Labor Committee is the committee that looks at anything having to do with, in this case, we'll say ERISA, which is the labor law that governs federally regulated health plans that are not government health plans. And the majority of us who work for employers, most employers now are self-insured, which means that those plans are federally regulated by ERISA. So step therapy hitting the commercial market would have to be an ERISA change. And so that's why that particular bill at the moment is sitting in that committee. But Energy and Commerce really looks at a lot of, kind of anything around the ACA, marketplace stabilization issues, things like that. The Energy and Commerce Committee does those same things that we were just talking about around even some telehealth stuff, mental health programs, things like that. They would be the jurisdiction there. There's not going to be quite as much change there. I think Kathy McMorris Rogers, who's currently the ranking member from Washington State, will take on the chair role, and the current chair, they'll just kind of flip places. Frank Pallone from New Jersey. So they both have a lot of sort of long-standing exposure and experience on these issues. So I think that's what I would say there. I don't know, Lisa, if you have any other thoughts, anything to fill in there.
I just have another, I think sometimes we like to talk about all the on the surface level. There's some really interesting things, but I'm curious what your personal opinion is here too, Anna. As we're preparing to see the House change party control for only the 11th time since 1900, so 6 times from Democrat to Republican, 5 in the opposite direction. And then the Senate is currently in this 50-50 split, which we know, which is only the 3rd time since the direct election of senators began in 1914. What are you thinking about, how often we're changing parties? What is kind of the momentum? What is the atmosphere on the Hill going to be? Are we going to see massive waves of legislation, or are we expecting kind of a amp up to anything, or kind of a dull year? What are your predictions here with such party turnover and change in leadership?
Well, it's definitely one of the smaller margins we've ever seen. The margins are pretty razor thin, both House and Senate. So that means that the leadership in both the House and the Senate are going to have, I think, a really difficult time trying to get consensus in order to pass bills. Because of that, we're, I think, more likely to see moderate style bills, not the big sweeping type of bills that we've seen a handful of in the past few years. I don't know that it means we'll see less action. I just think it's going to be a little bit more tempered, perhaps. I think the trick for us is going to be figuring out where those bipartisan kind of inflection points are, and making sure that our priorities and the patient voice is part of those conversations. So a handful of those that we know have a lot of bipartisan support going in are around telehealth. We've talked about that already, which is critically important. There is, just like with this Congress, where there was a lot of emphasis on drug pricing and out-of-pocket costs. In the next Congress, we anticipate there's going to be a lot of scrutiny on pharmacy benefit managers, who were largely kind of not as much part of the conversation this Congress. And I think that the PBMs are aware of that too, and sort of preparing in kind. And that really has an impact on us, because a lot of the issues that we spend a lot of time talking about, step therapy, prior authorization, mid-year formulary changes, even how, formularies are structured and how much co-pay and co-insurance you pay, that sort of thing, accumulator adjustment programs, a lot of these issues are sort of PBM-led policies. And so being able to be part of that conversation and seeing what the potential areas for getting these critical sort of guardrails that we've long fought for, sort of part of that bigger conversation, that might be a place that we could see some bigger legislation. But we'll see what happens when the committee structure and everything's kind of set and going. But those are my kind of initial thoughts. I think there's obviously some questions about what happens with COVID funding, for example, some of the other public health emergency pieces, things like that. We're seeing a lot kind of in the news and a lot of prognosticating about what might go forward, what happens with, you know, vaccine coverage, all sorts of things like that. It'll be interesting to see when the committees and the House and Senate leadership come out with their top priorities and what they plan to spend their time on. But fortunately, with Alisa's sort of leadership on this, we've been engaging a lot with some of the work force sort of task force efforts that have been done in preparation for the next Congress. So we've already laid the groundwork to have a strong patient voice, I think, in whatever sort of healthcare forums may be available for us in the next Congress.
Yeah, I think that's right. Not to get super wonky on y'all, but we have very successfully been working, we work bipartisan. We are championing, both Democrats and Republicans, but understanding that the Republicans are going to be taking over leadership in the House, we wanted to get in early to make sure that they knew our priorities very early and upfront. So we've actually been engaging with members well since the summertime, when Republican leadership was setting up this task force. They called it the Healthy Futures Task Force. And we were successful in getting step therapy and prior authorization included as priorities for them, which I think was no small feat, to be very frank with you. It was a really big lift, and I'm proud of us for getting that in there. And we are teeing up some leadership conversations now in preparation for the beginning of the year. So pulling out some very traditional lobbying efforts to get in with staff members very early, getting it on official paper documents in writing, and getting commitments from people like yourselves, constituents, coming to their members and saying, we want you to engage on X, and they're complying. So I think it's a really great success to talk about, the movement. We're also looking at messaging campaigns. How are we telling the story differently on subjects that have been top priorities for us, the Arthritis Foundation, but a lot of patient groups? How can we partner with some of those other groups? Because we've heard from a lot of you that you'd like engaging with other groups. People like ACS CAN, the cancer patients. We work very closely with heart and lung, LLS, leukemia, lymphoma, a lot of those groups. We're really strong partners at the staff level, and we've heard from you, the patients, that you like working with them too. So I think it's really exciting. It's a great time to be building relationships with your members at the state level as well. So Melissa's going to talk a little about what the state level engagement looks like. But before we jump to that really quickly, maybe Melissa, you can come on board too, but when and how should advocates introduce themselves to new members, federal or state? Like, how do we start in January really hot and fresh and say, hi, I'm Alisa and I'm an Arthritis Foundation advocate. These are my priorities. I want to build a relationship, especially with so many new members, federally and state. Anna, I'll pass to you first. And then Melissa, I'd love to hear your thoughts.
Question. And I see one just came in the chat that's basically that exact question. So I'm so glad that those threads came together at the same time. So here's the thing. The members of Congress get sworn in January 3rd, but it takes quite some time, especially for freshman members, to build out their staff. So we're already thinking about this and how to make sure that you all are resourced in order to have those conversations. The first answer is it's never too soon to reach out to your members of Congress. Even if they're freshman members, they are doing their orientation. Freshman members have orientation just like when you're going to college and you have freshman orientation. It's the same in Congress. So they've been in DC already having orientation. They'll be out in the community, especially with the holidays coming up. I'm sure they'll be doing public events and things like that. So it's never too soon to start reaching out and making those relationships and connections with the members themselves. Now, you all know, if you've done Hill visits with us and things like that, that building the relationships with the staff is equally as important. That's where it gets a little tricky. If you have a member of Congress who is coming back, then they may have a staff person who's carrying over, and you don't have to go back to the beginning. However, if you have a new member of Congress, they have to build their staff from scratch. And sometimes that takes time. So we tend to wait a little bit. Sometimes we'll go up to the Hill. Of course, this was pre-COVID days when you could just freely go up to the Hill, but and sort of walk the halls and just be a presence. But in terms of really building those relationships, it's really more like February, March, sometimes even before they have an actual health staffer in place. And you can start having those granular conversations about what issues they're going to take on and what bills they might support and things like that. So what we're planning to do, just as kind of a teaser, is we'll have a Welcome to Congress packet. We do this every 2 years. And what we'll do is we'll put in specifics about our priorities, specific bills like the Safe Step Act, which we know we're going to come back. And really the Welcome to Congress packet will have really specific ways that member of Congress can support you and the Arthritis Foundation. And we'll have some other ways that you can sort of talk about who we are and, tell your patient story to them and start to build the relationships with their staff. So you'll see that in an upcoming Advocacy in Action, and we'll really be sort of encouraging people to use the Action Center in order to send that Welcome to Congress packet to their members of Congress offices. The other thing I would say is that, it often takes a while for members to determine what their priorities are going to be and what issues that they want to sort of sign on to and that sort of thing. So where we'll really do a lot of the heavy lifting in terms of, getting specific bills introduced and then trying to build co-sponsor support. We're going to see that more, I would think, later in the spring into the summer in preparation for our summit, which is coming back in person for the first time in 3 years in September next year. So that's kind of a new change. So that should be a really interesting sort of opportunity to really get in there and start to build support for a lot of the issues that we care about when we're getting towards the sort of halfway point of the next Congress.
That's perfect. And I want to transition into state and bring our lovely new state legislative affairs director up with us. Melissa, I know this was a hot election for everybody at the state level is very, very important. I personally know that we are both big fans at the state level. And this is the first election after the 2020 census, which also included reapportionment or redistricting of 6 states at least who gained seats in the House and 7 states lost seats. Give us an overview. What happened? I know we're talking governors, we're talking states, we're talking local districts. What's the lowdown on the state front?
Sure, absolutely. And just to, build off of what Anna said in terms of reaching out to newly electeds, of course, we have a lot on the state level, even more so than the federal level. And I will say, it really varies by state as in terms of when that torch is passed to the newly electeds. Of course, with incumbents, you can reach out pretty quickly. They have established offices. They might be moving offices physically, but if they are moving into leadership, for example, but it's never too soon, especially if they are an incumbent, to reach out and say, congratulations, looking forward to working with you in the year ahead. This is my expertise and experience as someone living with arthritis. Looking forward to working with you on a variety of priorities as we look forward to the session ahead. Now, I will note for newly electeds, those that haven't held office, it might take some time for them to even get their official government email address. And I do want to caution you not to message their candidate office about legislation, because some states have laws where you cannot do that because it's considered lobbying, but it's, we're not to the next election or past election cycle yet. So they're not holding office. So it's not technically appropriate to message a candidate's contact information about legislative priorities for the year ahead because they're not sworn in yet. So once their office is situated and they have their contact information up, that's when I would say to start reaching out if you live in a district where there's a newly elected or, in a state as we cover these election results where there's a change in control in the areas that represent you. But there is certainly opportunities to, again, start the year off right by just offering some information about yourself and lending yourself as a resource and a spokesperson on these issues. So as bills come up for the legislative session, they know that they have someone in district to reach out to that can provide information and stats on the impact of arthritis in their communities. So just that quick note before we dive into these exciting results. Certainly with the governor's races to start off here, we had 36 governors up for election. Not everybody's up in this the 2022 cycle here, but those that were up, we did have 2 flip overs, and those happened in Maryland and in Massachusetts. Those were some interesting states to watch. First of all, because it was a record-setting year for governor's races in terms of the amount of women that were running. But for Massachusetts and Maryland, for example, Governor Hogan was the outgoing governor for Maryland, and Governor-elect Wes Moore, who won, was the 3rd Black governor-elect to be elected and will be the first Black governor for Maryland. And then for Massachusetts, the outgoing governor, Republican Governor Baker, will be replaced by the first female and openly gay woman in Massachusetts. So that is another record-setting development for just the lay of the land for the governorship across the nation. So 2 exciting victories for the governor's offices in the nation, but also just an important lay of the land to look at the map to see kind of, we're pretty close to an even split here whenever it comes to the control with the Republican Party and the Democrat Party in the executive branch across the nation. That's important to watch. As we know, with the pandemic, a lot of policymaking was happening through the executive branch, through emergency declarations when it came through health policy. Things around telehealth, for example, that are later and probably this legislative cycle likely to be considered to be codified or written into state law. So things to watch for in terms of the executive branch's influence. So they can really influence policy. They certainly have their own agenda. Watching the State of the State addresses, to me, is just as important as the State of the Union. So usually those happen in January for most states. But definitely pay attention to the issues that they bring up. Certainly every governor coming in, whether they're an incumbent or newly elected, will have their own set of priorities. I certainly anticipate the economy to be first and foremost in front and center in those State of the State addresses, but definitely watch for health policy issues to be talked about, especially as the pandemic and really just chronic disease management continues to be a conversation at the state level. So if we want to flip to the next slide here, we can talk about the legislatures. This is even more offices that were up for grabs across the nation. So 46 states, over 6,000 legislative races, a lot up for grabs in terms of control of chambers, as well as when you combine the governorship, control of the state whenever it comes to partisan focus. So going into 2023, Republicans will control 57 legislative chambers compared to the Democrats' 40. So it's interesting to kind of watch and see which chambers have flipped. We did have 4 Republican-held chambers that flipped to blue. So in Michigan, both the House and the Senate. In Minnesota, the House, and in Pennsylvania, the House. This kind of, lay of the land switch is important whenever it comes to our messaging and how we talk about our issues. I think it was mentioned at the top of the webinar, arthritis doesn't hold a political party. It is definitely a purple issue. It is impactful for every American across the nation, and likewise for every elected official. So while it matters to pay attention to the party control in terms of how we talk about our issues, the core meaning behind the policies that we push and the equity behind it is going to be important to convey to these newly electeds and to the entire composition of the legislative branch on the state level. So Pennsylvania and Virginia still have split legislatures, so definitely something to note as well, because you won't be talking to each chamber the same way as you will be in these other more party controlled chambers in the state level. So it really holds true to pay attention to how much control the legislature has in the process of passing a bill into law. With veto-proof majorities, most of the legislatures in the nation, over half, likely, if we look at the results remaining, are going to have those veto-proof majorities, which takes away some of the executive branch power there in terms of how we lobby our priorities. But it's important to just pay attention to that whenever we are passing a bill into law. It's not just the legislative process that we have to pay attention to. It's once that bill hits the governor's desk, how it becomes law, and if we have to go back to the legislative branch to override any veto, whether that is a full line veto or partial. So something to pay attention to on that level as well. Again, I had mentioned that state control is more unified on the party level, so very party focused. So if they were Democrat, they're even more Democrat. If they were Republican, they're even more Republican. And those divided state governments lower than ever. So we definitely need to pay attention to how we message our priorities. But again, arthritis is nonpartisan. It is an issue that impacts so many across the nation. So conveying the priorities through your stories, through your real life experiences is what is going to win the day for us in 2023.
And Melissa, I know we only have a couple minutes left, so I'd love to bring Stephanie back on, and maybe we can all talk very briefly about what the state level outlooks looks like for our last slide. And be sure to ask your questions in the chat. We'll try to answer them if you come up with them. But Stephanie and Melissa, we'd love to hear what can advocates do at the state level? Kind of what are we thinking for the next year or so?
Sure, and I covered some of these bullets as I was talking about the results here. Lots of opportunities to engage on policy activity in 2023. Every state will be in session. 45 of the states will start in January. A lot of the budget activity will be January through May, with a big focus in March and April. And then, we'll definitely be watching those budgets. Not a lot of policy tends to go in budgets, but it is important looking at our appropriations on our issues, especially if we have programs and services that we're advocating on that need a dollar amount to back that with staff positions to run those programs. But also, education is just going to be critical. We have a lot of freshman lawmakers coming in, but even the incumbents, we need to re-educate and re-show the value of the issues that we're working on and how much their districts are impacted by arthritis. So pushing for those equitable policies, again, emphasizing your stories, because I can go in and I can talk to our lawmakers on every state level branch of government and push those facts and figures, but your stories are what make it real. So just definitely pay attention to whenever we have action opportunities. There will be a lot of state activity this year.
Great. Well, I know we have covered a lot. We've covered really more than 2 years of policy priorities and work and things like that, looking back at the past 2 years of Congress and state legislative sessions, and then looking ahead to 2023. So we've covered a lot of ground. You've digested or been presented a lot of information. So if you have any other questions, we're happy to take them in the chat box, or feel free to email us here at advocacy@arthritis.org. I failed to put it up on the screen, but I would encourage you to engage with us on Twitter if you are on Twitter as well. We are at AF Advocacy, Arthritis Foundation Advocacy. Again, AF Advocacy, and we post all kinds of stuff there. I think, like everybody said throughout the presentation today, more than anything, we are going to be calling on all of you with all of these different topics to share your personal experience, to encourage your family members, friends, and your community around you to join in as well. So we will keep you posted as everything comes up. I think you'll get your December Advocacy in Action here just next week, and then we'll kick off January with our Welcome to Congress packet and everything else. And I see the question in here about Advocacy Summit. We are excited to have that in person next year in the fall instead of the spring. So we'll be in DC in September 2023, and as soon as we have more details about the specific date and location, hotel information, all that good stuff, we'll be sure to share it with you all. But I know we're at time, so thank you all so much for joining. Again, if you have any questions, feel free to send them to our email here. I want to thank Anna, Alisa, and Melissa for joining me today, and we'll be sure you all get this recording afterwards. So have a good rest of your week, and we'll talk to you soon.
Thanks, everybody.